Hi, it's Christi Bintliff. Thanks for tuning back in to LEAP2 Solutions. First, I want to thank you for continuing to follow me. I know my voice can be a little annoying at times because it's so high-pitched, but what's a girl to do? Today, I'm talking about in-network versus out-of-network providers. Now, some of you tuning in may not know what that means, and don't feel bad. When I interview a lot of associates, they don't know. But if you are a dentist and you are coming out of school and getting ready to buy an existing practice or do a startup, these are things you want to know, and so that you can see if that's going to work for you in an ownership practice role. In-network providers means that you are contracted with several or one insurance company. You have signed a contract that you agree to accept their fee schedules and adjust off whatever is left over and not be billed back to the patient. In a private practice, in an out-of-network situation, we are not contracted with insurance companies. We can be fee for service and request that all fees be paid up front in full, and it would be your responsibility to file your insurance on your own. Or we can be on the structure of we can file insurance as a courtesy for you, but we will bill you the difference and request that you pay that amount due. There will be no adjustments. So which is the right fit for you? Well, that depends on your area. If you choose to be a network, or you're buying a practice that already is a in-network provider, I would encourage you to look at your contracts, make sure that they are current and have not expired, or if they have expired, request to see any addendums, because that could indicate that there has been a fee structure change. If they're up for negotiations, if you're uncomfortable with that, then try to seek out a specialist that can work with you in negotiating with the insurance companies to get a higher payout. If you have a lot of insurances that you're in network in and your practice is struggling for profitability, then I would encourage you to look and see if there's some of them that you can drop off if their contracts are coming up for renewal. In private practice, you may be saying, how do they make it? How are they profitable? How can they do this without being in any insurance networks? It works fine. In disclosure, I've worked 33 years of my career in private practice that has filed insurance as a courtesy, and there's never been a problem. Sometimes when financial things happen, patients may leave because they financially, it might be better for them in an in-network where they don't have out-of-pocket costs. But I will tell you that 90% of the time and over my career, once they've left for in-network, they usually come back to us because it's just a different environment. So back to my point, if you're buying a practice, you're getting ready to start one, you got to make a choice. Are you going to be in network with some of the insurance companies? If you're buying one, you need to make sure that you look at the contracts before you actually do your purchase here for this practice. Make sure that those contracts are up to date, know what those fee schedules are, and know if they've been recently negotiated. And if you're buying one that's out of network, like how I have worked my entire career, just learn how that side of it works in relationship with billing as a courtesy or fee for service. Anyway, this video is a little bit longer than what I normally do, but it's just because I wanted to give you some explanation. If you want some more information, hit me up at leap2solutions@gmail.com. Thanks.